I am Hamza Said, your host, and I welcome you all to our first episode of Women Healthcare Professional Resource Hub podcast. Today, our theme of this podcast is Launch of Women Healthcare Professional Resource Hub. Our guest is none other than the founder of WHPRH, Professor Dr. Madeeha Malik. Dr. Madeeha is also a renowned pharmacist and researcher working as a director and professor at Pharmacy Department of Hamza University, Islamabad campus. Dr. Madeeha is the first and the youngest female professor of pharmacy practice in Pakistan. She has recently also received National Fatma Jinnah Pride Award this year at the Governor House, Punjab for her contributions in pharmacy education. She has published more than 100 research articles and represented Pakistan in more than 22 countries. She is also the focal person for Pakistan for various international research organizations, including Eurocall and IHCOM. Assalamu alaikum, ma'am. How are you?
Walaikum Assalam. I'm very good, Hamza. How are you? And thank you very much for inviting me here today.
I'm good. It's a great pleasure to have you here today. I would like to start our podcast questions with you. What was the idea behind launching this WHPRH?
Okay, now this is a very interesting question. Actually, there was one sentence which actually pushed me to, launch this Women Healthcare Professional Resource Hub. I was presenting somewhere and I was talking about gender equity, and then I had to quote a report, and according to that report, it was like the male healthcare professionals always, or researchers, they always like to work as connectors, while the female healthcare professionals always like to work as isolators. So this thing was, very disturbing for me, and I just, sat and I thought about it, that why is it so that, female researchers are not being portrayed, or they're not supporting each other the way they should be. And if you look at the global statistics, so 30% of the world researchers are only women, and only 19% of the women researchers are from Asia, like the South and the West Asia. So, being a researcher and being passionate about research, now this thing was another thing which was very disturbing for me. So, and then there's a third thing, that is usually we always work, even within our professions, we always work as in isolation. The pharmacists will be working just as a pharmacy group, or the doctors will be working as a doctor group, so the healthcare sciences people will be working as a separate entity. So the idea behind was to basically also promote the interdisciplinary research and to produce evidence-based data for the healthcare system, because only one group alone is not able to produce that data which is required to basically implement or design and implement the interventions. So I always, my team is always very good, and they're always ready for the new exciting ideas. So I think February we launched Equity Pakistan, which is basically a collaboration between UCL and Hamdard, and that is purely focusing on gender equity issues of purely of female pharmacists in Pakistan. And then we came up with this idea that we need to do something big. We need to have a platform where all the women across any healthcare profession needs to come, and they need to have a platform where they can work in collaboration with other healthcare professionals, and they promote research, and they promote collaborations, and they produce certain data. And one of the things which I always listen from young women working over there is that we do not have mentors. And when I always ask them, why you do not have mentors, so they always tell me that no mentors are available in the market for us. So then we came up with this idea to launch a platform who have the mentors, who have the potential to lead the profession, and let's do it together. And we, as females, we believe now in the concept of the collaboration among females is being changed now. It's like more of a sisterhood. So now we believe in supporting each other and elevating the whole healthcare profession. So this was basically the idea behind launching this app.
Now, ma'am, if you could tell us what are the objectives of WHRPH?
Basically, the main objective of WHPRH is that we want whenever we look at national databases, female researchers, specifically healthcare professionals, have not been portrayed the way they should be, you know. And like if you even you look at the directory of Pakistan Science Foundation, or you look at the directory of HEC, or any research directory, we do not see like I know a very good number of female healthcare professionals who are doing amazing research, but I don't know where their research is being projected. So the first objective of basically WHRPH is to launch a national directory of women healthcare professionals and researchers. So this is our first main objective of WHRPH, and Alhamdulillah we are going to launch this WHRPH on this World Pharmacist Day, and we are giving the tribute to all the women pharmacists in Pakistan. And till now we have like 100 registrations, and we are coming up with our directory, and probably there are more to come in the future. So the first objective is basically to make a national female healthcare professionals and researchers directory. The second objective of WHRPH is to provide a platform where we have like three groups, like the mentors, the emerging female researchers, and then the young female researchers, and then there are the students. So whoever want to get the mentor, who is interested in getting the mentorship from different people, so they can have it, we can connect them to the mentors. We have specifically designed CPD training and different workshops for different female healthcare professionals, and then we have our research roadmap, that how we are going to how different female healthcare professionals need to collaborate together in order to produce that evidence-based data for the healthcare system of Pakistan. So we have all the roadmap available for that, and the most important thing is that we are going to liaison with the international community. So we are very focused on it, that in the coming 6 months to 1 year time, we are going to get this this hub being acknowledged and be supported by International Federation of Pharmacists, by UN Women chapter, and by you can say Commonwealth. So we are also focusing on that, and beside this we would like to see many females coming at leadership positions, but I think that leadership comes with certain traits which needs to be acquired, and emotional intelligence is one of them. So probably we thought of training our younger colleagues in the direction where they could come and take the lead without facing the issues which we had faced during our journey reaching there. And last but not the least, probably we look forward that we are going to launch our own female-led research journal, which will be supporting our research and also providing the opportunity to young researchers to get their papers published in that journal. We have also an magazine that is also being that has a specific ISSN number. We have taken that ISSN number, and it's also international. So promoting our voice and to the world, at how we look, and obviously highlighting certain issues related to gender equity in Pakistan, which our female healthcare professionals are facing. And we believe that we are not just going to highlight them, we would like to advocate them, because when we are united, we are more stronger, and we are going to find the solutions for them. And probably we are going to, inshallah, I think you can say like in the I see it like in the coming 5 years to 10 years time, I think this hub will be the main entity or the main leading body who could give the recognition to the female healthcare professional voice in Pakistan.
Now, ma'am, how do you see this platform different from other similar platforms?
Okay, how I see this platform different from other platforms is because there are so many other different platforms which are led by the females across Pakistan, and they are doing amazing work, no doubt about that. And I would like to acknowledge their efforts, and I really appreciate them. Like I see a lot of women in technology doing this stuff, and I've seen lots of entrepreneurs who are doing this stuff, and providing trainings and encouraging other women. But the different thing about this is that I have not seen any of the platform which is basically promoting research. Because what I see is that research is the backbone of everything, and research is basically the stuff which will lead you which would help you to identify the problems, and then that would be taking you to design set interventions and going to implement them. So this is something different, and then this directory would be the first of its kind, who would be, I think, giving projection. Like I said, that I really need to see a lot of women coming in research and projecting to the international world. So probably that is one of the thing. And the other thing is that I think that this would be first of its this platform would be the first of its kind, who would be which would be promoting interdisciplinary collaboration. Because I think the healthcare profession is one of those, the only profession which in which the healthcare team, I don't know why, it might be at times a myth or certain times a fact also, that the healthcare team does not want to acknowledge the role of each other. So we just wanted to come together, sit together. We would like to show that every person in the team is important, and every person has his or her own role, and they need to play in their domain. So just let's come together and work together, and let's do our role. So I think that this platform would be doing that part, which needs to be done, I think, by certain other forums which are unable to do so till date.
And ma'am, how do you think this hub will promote us towards the research culture in Pakistan?
And one of the biggest problem in Pakistan is that we do not have that mindset for research. And then the other thing is that we lack the trainings and the technical part. We do not miss. And it's like more of a stepper idea that one fine morning you wake up and you say, oh, okay, I want to do research on this, and without knowing the need, or without without looking at the different research methodology. And it could be more methodological, like and more logical than just you wake up in the morning and you just start researching on certain things, and then the papers are not publishing, or you're not getting, your research is basically not recognized as it should be. So probably what I think is that we have already developed a research plan which would not be only focusing on pharmacists, that would be focusing on across the healthcare profession. So I think that we have already we are on it. We have already planned our research roadmap, and it's not like only the pharmacists have been planning this. We have our certain team leads, like for the dentistry we have Dr. Joria, who would be leading our that wing, and Dr. Sonia, who would be leading the doctors wing, and then we have certain other healthcare professionals for our allied healthcare professions and all, and then for psychology and for chemists and all that. And then we have basically sit together, and we have devised a mutual research plan that where we can fit in to promote interdisciplinary research. So I think that would be more benefiting in the local context, and that research would be providing more you can say solutions towards the government as well as the different regulatory authority bodies. And probably researchers, if you ask me that how you would be promoting research, obviously I cannot tell you in one sentence, because I cannot tell you the roadmap right in one or two sentences. It's in phases. So we have developed different phases, and I think it's a 5-year plan. And then we are going to see every annual year we are going to project it, and we are going to do the analysis, and we are going to see we are going to use the Python research software for that, and we are going to see that what are the different themes and how it will be taking us towards our next ideas for research which need to be conducted in Pakistan. So probably I think, and more what I can say in one sentence how it will be promoting is, I think it will be promoting research by changing the mindset, and by by providing this research skills to the researchers across Pakistan.
And how do you think this hub will address the issue of gender equity? Because it's a major issue in Pakistan.
Hamza, I agree with you that gender equity is a major issue in Pakistan, but it's not only in Pakistan, it's across the world. So probably I think that I cannot say that probably it would not be focusing. One of the, you can say, the objective of this hub is also gender equity, and probably we would be also getting suggestions from our Equity Pakistan hub, and we would be seeing that how we can move in. But more of this, I think the only way through which we could highlight the problem of gender equity is again through research. It's not like I am saying that gender equity is a it's a problem in Pakistan, or you are telling me that gender equity is a problem in Pakistan. So I think we need to provide some evidence-based data highlighting the research, highlighting the issues related to gender equity, which might be case studies, or which might be other cross-sectional studies, or different even simulation studies. I don't know, we are planning for that, but I think again this hub will be specifically focusing on research more. So probably through research we are going to identify the problems, and we are going to I think we are going to raise our voices, and we are going to do our action plans. And I believe in publishing, so we are going to publish a lot at the national as well as international level. We are going to promote, we are going to arrange so many conferences, so many webinars, and seminars where the voice could be heard. And not a single member of my team would be going and presenting without evidence, because we believe that with evidence, when you talk with evidence, people listen, and that is more stronger voice. So I think in that way we would be highlighting.
Now, my last question of this podcast will be: where do you see WHPRH in the next 5 years?
Okay, I think I already answered this question back, but still I think that I'm really hopeful that with this dynamic team, and who are always supporting me with every wild idea I have in mind till now, I see WHRPH as a national, you can say, organization or association in itself, which would be leading the women healthcare professional community all across Pakistan, and would be projecting the true face of the women researchers of Pakistan to the world.
Thank you so much, ma'am, for your precious time. After listening to this podcast, our women healthcare professionals would be inspired and motivated to be part of this hub and this team. Thank you so much for your time. And to our viewers, I would like to say stay tuned to our YouTube channel for more podcasts acknowledging and showcasing the achievements of our dynamic and marvelous women. Thank you so much, and please visit our website www.whprh.com. Take care and Allah Hafiz.